Imagine a beautiful morning, you are just waking up, and suddenly you get a pesky back pain when you try to get up to a sitting position. Now, does that sound like a familiar situation? That is literally what I call a pain in the neck. Sorry for the pun, but it really is a pain in the neck and could literally spoil your whole day. Now, it's pretty common, and most men or women get neck pain for the same reasons that they suffer pain in their lower back. For most of us, it is a common and routine muscle strain and sprain. After all, don't forget that the neck has to support that heavy load at the top, especially when you carry all your problems you are facing from the office or wherever you are to your home. Now, is there a remedy? Fortunately, the remedies for neck and back pain have some similar things in common. First and most important is the early intense pain with rest, with ice, and with heat. Then move on to the gentle stretching and strengthening exercises. This actually will make the muscles stronger. Later, to avoid bad posture and other habits that could trigger another neck pain crisis. Now, what could this bad posture be? Well, sitting at a desk for a length of time without taking a break, little or no exercise, and staring at the computer screen for a long time, which is not only common for people at work, but can be from those who work at home and those who are doing maybe like YouTube or Twitter or even TikTok and whatever social media you have. So if you are sitting at your desk for a length of time, looking at the computer without taking a break, without taking a stretch, do watch out because this may happen to you. So imagine it happens. So what can you do to relieve the neck pain? Let us start with the first few steps. The reason for a routine sprain and sprain neck pain may vary. If you wake up with a crick in your neck, it's probably the sharp muscle contractions known as spasms, which are caused by a muscle sprain. Now, a sprain in contrast happens in ligaments, the tough tissues that connect bones together. Or in the alternative ways, a tendon, the tissue that attaches the muscle to the bones, may become inflamed, causing tendinitis. Now, what can you do to self-help yourself? Because I'm sure you don't want to be going to the doctors all the time. Okay, you can use a cold compress or a bag of ice to numb the early acute pain and reduce inflammation. This really will help you because sometimes you are just so irritated by the pain, you just want it to go away for a little while. Now, take over the counter the pain relievers to control the mild or moderate pain. This can include things like acetaminophen and those anti-inflammatory drugs or even aspirin. Now, use the neck collar for short issues of period of time to give rest to the painful muscles and the tissues and ease your personal discomfort. Collars do have a bad reputation from people overusing them and then getting their muscles weakened. But used for a few hours here and there, they can be very helpful because they do provide support for the neck muscles, which then relieves the pain from the neck. Applying heat. Now, with a heating pad or using a warm whirlpool bath if you are lucky to have one, after a day or two, once the acute pain calms down, this helps to relax the muscles in the whole body, which is really good for you. Should you then go to a chiropractor to get your neck cracked and reduce the stiffness? It may be fine for low back pain, but generally avoid it for neck pain. So what are some of the therapeutic exercise for neck pain? Now, what you can do to exercise to strengthen and stretch your neck, shoulder, and upper back muscles can speed recovery from a painful neck condition and probably reduce flare-ups, although the evidence for this is not ironclad or clad in steel. It is best for patients to see a physical therapist for guided therapeutic exercise. What a therapist offers is as below. Now, the therapy will likely be a combination of isometric and range of motion exercises, which means you tighten your neck muscles against an opposing force, such as your hand, which you push against with your neck muscles. Now, range of motion stretches attempt to progressively relax and lengthen the neck muscles. What can a physical therapist do? They can give you other therapies that is, while not totally proven, it seems to give people some comfort and ease with their neck pain. One option is ultrasound treatment of the sore issues with a high frequency sound wave. Our physical therapists can also perform traction using the hands or special equipment to gently stretch the neck muscles. You can also get equipment by prescription to perform neck traction at home, but do follow the therapist's instructions carefully because the neck is a very important part of the body and we do not want anything untoward to happen. Now, take a note of your posture and the daily habits that could trigger neck pain. For example, sitting for a long period of time in a position that strains the neck, like reading, TV watching, computer work without taking a break, or having a short coffee break every hour or so, not just to walk away from the desk and give yourself a bit of stretch, or sometimes sleeping in a wrong or a cramped position. You may not know or realize it because you may be so tired after work and after a bath just fall asleep without realizing that you are in a bad position which can cause a cramp or a pain in the neck. Attending to the cause may stop some flare-ups of the neck pain at the source. Is this something you should be worried about? If the neck pain is severe and well it goes on for weeks or months and it limits your ability to move your head or release into your shoulders or feels worse in the morning, consider seeing a doctor just to rule out any issues that you may not be aware of. It can be due to things like underlying physical problem like arthritis, infection, or a compressed nerve. It may be the cause. So it's good to know and feel comfortable that you are in good health. Now, depending on the diagnosis, you may need additional treatments or even surgery to relieve pain and get back to your normal activities. What exercises can you do to help yourself sometimes prevent all this neck pain? Look ahead, straight ahead, and tuck in your chin slightly and move your head backwards. Slowly, gently, keep the head level on a straight line. Your head should be gliding backward and forwards, not being bent. Now hold this for 5 seconds and then repeat 5 times. So this will really help you to actually reduce pain that may be on your neck without you knowing it.